Hello, everyone. Welcome to today's AFTD Educational Webinar, Answering Questions and Providing Support, a Q&A with AFTD HelpLine staff. I'm Esther Kane, and I am AFTD's Director of Support and Education. Thank you for joining us. This is a special webinar focusing on the AFTD HelpLine, a resource for all people affected by FTD, including persons diagnosed, care partners, and healthcare professionals. In a couple minutes, I will be joined, actually they're joining me now, by 3 members of AFTD's HelpLine staff to answer some of the most common questions we receive. We'll also take time to answer audience questions, which you can submit using the questions box on your screen. Add your questions as you think of them, and we'll answer as many as we can after our main presentation. Also, please note that our entire audience will be muted throughout the webinar. In order to keep background noise to a minimum, if you are experiencing any technical issues, please write a message in the questions box and we will do our best to resolve them for you. We will also be recording this webinar and archiving it for later viewing on AFTD's YouTube page. Before we get started, I have just a couple quick notes on recent AFTD happenings. AFTD has launched its Advocacy Action Center. This is an easy way to learn more about AFTD's advocacy activities and help to influence public policy on FTD. With a single click, you can encourage federal legislators to learn more about FTD, as well as sign up for future campaigns to support research and improve FTD care and services. Visit the website on your screen to learn more. AFTD also encourages you to stay informed about all our resources and publications. Scanning the QR code on your screen will allow you to sign up with AFTD and receive specially tailored materials and newsletters. And of course, if you need personalized support, our helpline is there for you. Call the number you see on the screen or send an email to info@theaftd.org. Speaking of the helpline, today's presenters are the people who answer the thousands of phone calls and emails we receive each year on the helpline. Stephanie Quigley is AFTD's helpline manager. She's also a licensed social worker and a certified dementia practitioner. Throughout her career, Stephanie has made a personal commitment to help with the education and assistance of families, in addition to advocating for older adults and caregivers in various healthcare settings. Ann Schoonover is AFTD's helpline specialist. Ann is a licensed social worker with over 15 years of experience helping individuals and families access resources and services in mental health and healthcare settings. During her career, Ann has worked in hospitals and skilled nursing facilities and has advocated for older adults and caregivers as a geriatric care manager. Finally, Josephare Joseph is AFTD's helpline advisor. Josephare earned her master's in social work from Columbia University. Currently, she works to maintain and enhance the quality of resources available for individuals seeking support through the AFTD helpline. AFTD's helpline responded to over 3,000 calls and emails last year from people diagnosed, care partners, family, and healthcare providers, providing much needed resources, support, and information. FTD can be an overwhelming diagnosis to navigate. From the moment a person realizes something is changing and throughout the FTD experience, people need guidance and support. Today, we are going to go through some of the most frequent questions we get asked on the helpline and hopefully answer some of the questions you may have. So the first thing we wanted to review today, Josephare is going to answer for us. So welcome everyone and welcome ladies. So the question is, my spouse was just diagnosed with FTD. I don't even know where to ask or where to start. I don't even know where to begin. What do I do?
Okay, thank you, Esther. So we often get calls and emails from those who have recently received a diagnosis of FTD themselves or for a loved one. And FTD, this often means that they have gone through a long journey with often damaged relationships and misdiagnosis well before they even receive a diagnosis. And FTD is often a diagnosis many people, even healthcare professionals, are not even familiar with. So they may begin with an internet search or just become just too overwhelming with the amount of information that they receive. In these situations, we hope that they reach out to us on the helpline where they can speak to either me or my colleague Ann Schoonover or Stephanie. They can speak to us via email or through the toll-free line, and this give you an opportunity to speak with an actual person who understand and can help answer some of your questions. And we understand that some of the questions are sometimes so overwhelming, which can leave you feeling very overwhelming at this stage. And sometimes people reach out to us, they don't even know what to ask, and that is okay. We have talked to many people on the helpline and can help guide these conversations and helping you and your loved one learn and guide these conversations, whether it's no question is too silly for us. We can help you learn more and help guide you through this process and help you get connected to support and information along the way. And typically in these conversations, we'll help people know that they are not alone. We'll help answer initial questions and we'll help share digestible information. And we also let them know that about our support options available to them and their loved one, including our helpline, which can provide ongoing support throughout the journey. So this is just one way we offer our services to the helpline, whether it's to a new diagnosis or just having a difficult questions that you don't have an answer to.
Thanks, Josephare. I just also wanted to add that these calls are not always from the spouse or the person with FTD. We will also even talk to people that are friends or extended family members who may even live across the country. So just knowing that FTD can have such a wide range of impact, and we're really here to offer that support and information for anybody who has that connection to FTD, including health professionals. So we can talk through ways that you can provide help and support for the person with FTD and the primary care partner, even if you're not local to them.
Yeah, I think one of the things about FTD that is so unique is that it's very often, it's a unique diagnosis. And so families very often do need individualized support and really that one-on-one conversation about how to manage their particular situation, which is why the helpline really is a great benefit for those to be able to take advantage of. My next question is, I think my loved one may have FTD. How can I get them to the doctor and get an evaluation?
So this is actually a really personalized conversation that we have on the helpline to really help that person identify ways that work for their loved one. Since FTD can impact a person's self-awareness of the changes, and this is called andysagnosia, this can often make the person resistant to any type of evaluation or medical appointment. So sometimes FTD symptoms can overlap with other conditions where you might be able to, get a neurological evaluation to help rule out other conditions and potentially get an FTD diagnosis. We also know that many healthcare professionals are not familiar with FTD. So families also have additional challenges when it comes to, getting the person in the medical appointment and helping with that medical professional. We always can begin by suggesting that the person keeps a log of changes and events that they've noticed over time that they're concerned about. This can also be helpful when, opening up the conversation for even evaluation with the healthcare provider. AFTD actually has developed a diagnostic checklist for both behavioral variant FTD as well as PPA that can allow you to just check some boxes to help with that conversation with the healthcare providers. And this will also help the healthcare providers better understand that a referral to a specialist may be needed. We also can talk through ways to work together with other concerned family members or friends and really think strategically individually with that for that person, and to help maybe identify certain people that they may be more willing to listen to go to an appointment with. So even when andysagnosia is present, there still may be certain changes that are bothersome to the person or conditions, and individually we can kind of go through and see what they may be willing to go to an appointment with, and how that can help provide an opening for loved ones to also share their concerns. advocacy and seeing a specialist in FTD is often key to obtaining a diagnosis. And so on the helpline, we really help callers and find providers within their region as well.
Thank you, Stephanie. Can you help us better explain and understand the difference between degeneration and dementia?
Yeah, so I think, when often people first hear about FTD, it's like learning a new language entirely, a new alphabet. And it's really important to get an understanding of some of the things we're talking about, so then you can share your own experiences, and learning the terms for it. So the AFTD uses the term degeneration in our name as it refers to a group of neurodegenerative disorders, and it can be more specific and inclusive of the range of stages and the different diagnoses that fall in this group of disorders. However, it still does remain that the terms frontotemporal dementia and frontotemporal degeneration are often used interchangeably by health professionals and others, so that can be confusing. It's important just to be aware of that. And these are more specific terms, but in the past there were other terms used, such as Pick's disease was an older term that most often refers to what we now often call behavioral variant FTD.
Thank you, Anne. We do get that question quite a bit, and it can be a little bit confusing for families as they're trying to understand what actual diagnosis does my loved one have and what's really happening here. And even for the person diagnosed, when they're looking for clarity, it can be really confusing. So helping people understand that FTD has many different definitions, but it all means the same thing, I think can help people kind of center around what's happening with themselves or their loved ones. Another common question we get is, how do I know what type of FTD my mom has? She was originally diagnosed with behavioral variant FTD, but now she's having Parkinson's-like symptoms. Has her diagnosis changed? Does she have two diagnoses? What do you guys normally say in that situation?
Yeah, so this is definitely something that comes up a lot, and it's such an individualized question. You can't just search, and get an answer. So, as people visit our website and they begin to learn about FTD, so they see, that FTD refers to this group of disorders we were talking about. So in this group, it includes behavioral variant FTD, the primary progressive aphasias, which there's even 3 types of those, progressive supranuclear palsy, cortical basal syndrome, and FTD and ALS. So, but we know it's still really not unusual that a person may even just be given a diagnosis of FTD and their type is not even specified. In a lot of cases, this can refer to the behavioral variant because that is the most common type. It's just important always to remember that diagnosing FTD in general can be really difficult. And for a lot of people, they may receive a diagnosis of a specific type of FTD or PPA if they're connected with specialists or research centers that really are focused in FTD. And sometimes there's times when the diagnosis may become more specific, more refined with more evaluation and over time. A diagnosis of FTD of any type is a specialist best clinical diagnosis, but we're still limited in the available testing. Genetic testing can confirm FTD in some cases, but brain autopsy is still the only way for us to really know with complete certainty what was happening in the brain and the type of FTD the person had. But the other thing that's important to know is that, regardless of the initial symptoms somebody had or the type of FTD a person might be diagnosed with, over time, as the disease progresses, it can begin to impact other areas of functioning. So, and this can often lead to overlap and blurring among the different types of FTD. So, for example, like in our question, a person could be diagnosed with behavioral variant FTD, but they might start to show changes in language and communication or begin to display motor symptoms, which is sometimes even called Parkinsonism or Parkinson's-like symptoms as the disease progresses. So this doesn't necessarily change the diagnosis in most cases, but is a sign that the disease has progressed and starting to impact new areas. but it's still always important to document anything new that you're seeing, to share with the doctor. They can help better understand for your individual case, is this part of the expected progression, but also to rule out, are there any other health changes that are contributing to this? So it is important to know, FTD progresses differently in every person. We are all really unique. Our brains are really unique. And it is really difficult to predict how it might unfold in each person.
I think we use the saying a lot, if you've met one person with FTD, you've met one person with FTD. And not every two people or no two people may necessarily present with the disease in the same way. And so it's good to kind of be open and understand that it may look different in your loved one than it looks from somebody else who you're talking to, but understanding the general aspects of the disease and how it can progress can give you a lot of knowledge and information to help you kind of prepare for the future. So thank you, Anne. That was a really good answer to that question. Yeah, I'm glad you brought up genetics, because genetics tends to be another question we hear a lot about. It's confusing and it's hard to understand, and it can be overwhelming for families. But when we get the question, I'm worried about the genetics of FTD, but don't even know where to start to find out more, can you help? What do you normally say?
Yeah, so the genetics in FTD and navigating genetic counseling and testing can definitely be very complicated. And we do run into this question a lot on the helpline. So we have a bunch of resources and information to help people, have the background that's needed in order to understand all of their options and, what they need in order to even help navigate what they want to learn more about, because this is a very individualized situation. We strongly encourage anybody who wants to better understand their family risk to do so with guidance of a genetic counselor and experienced in FTD. But we know that in many cases that they're just looking for a starting point and information. Thankfully, with AFTD's continuing expansion of our resources, we have the addition of our manager of genetic initiatives, Kim Jenny, who is able to help provide some support and individualized questions as well to those who call in. And she also did a webinar that I would highly recommend called To Test or Not to Test as a good starting point as well.
I would also recommend that AFTD's website has quite a bit of information on it about the genetics of FTD. So it's a great place for you to be able to go and start to learn and better understand. You can take it bite by bite or piece by piece, just to kind of better understand what it means to have genetic FTD and to kind of answer some of your questions ahead of time. So please use that as a resource also. So can you share about how the helpline approaches questions about FTD symptoms or challenging situations in FTD? We know that FTD can cause lack of insight and lack of awareness of the disease process. And one of the questions we get asked a lot has to do with driving and FTD, or we get questions about managing other behaviors or transitions. So can somebody talk a little bit about how we answer those questions or how we talk through that?
Yeah, so this definitely is something that we do often on the helpline. And this is just one example of, we're not only speaking to people with new diagnosis. People call us, over time when they have questions like this that come up. And, although we have a lot of articles of resources that speak to some of these things on our website, these situations are very individualized. And on the helpline, it allows us to have these really personalized and tailored conversations. So knowing too that a lot of these situations or some of the behaviors can be really hard to talk about, and they can be really isolating. So these are things like financial risk, legal or criminal issues, driving, disinhibition, compulsive behaviors, but even aggression, safety, or increased sexual behaviors. So on the helpline, we really strive to create a safe and confidential space where you can share about these situations. And we validate, that there are things that can happen in FTD, and you're not alone in that. So we recognize that when we're looking at approaches to these situations, they really need what we call person-centered approach, multi-prong approach. There's no one clear, easy answer. It involves a lot of things working together that adapts to changes and adjusting expectations over time. So when we talk about this multi-prong approach, so it can often involve like non-medical, just like care, environmental approaches, education, about the symptom or situation, getting connected with others for support. Support groups obviously are such an important place where you can have a group of people who really understand your situation, where you can problem solve. And there are some cases where there are some medications that can be used to target at specific symptoms, but again, are most effective when they're used along with all of these other pieces. So we can't provide any medical advice on medications. However, we share resources that talk about what's the role of medications and types of medications so that you have the background. When you go into a medical appointment, you just can have a more informed conversation. And so, we keep in mind that, these situations, these symptoms are the result of FTD, changes in the brain. So our approaches are looking at the individual person, they're supportive, and they focus on what can we change and adjust in the environment around the person. Just looking at ways to reduce potential risks that are involved. And so this can be looking at ways to limit access, redirection. It's really individualized. And we talk about tools that you can use too, like our FTD behavior tracker. We'll talk about it a little bit later as well. So we know that these situations can be really stressful. We're there to provide support and try to help you get connected with the right resources. And the support groups obviously are really great, but our helpline can be there if you just really need this one-on-one discussion about what you're facing. And again, it's another great way to show that our helpline's there at all different points with things that you have questions about.
Thank you, Anne. I think another question that we get often, and this has to do with the FTD is less common. It's not as common as some other forms of dementia, and it's not always well known by healthcare providers. And because of that, many people struggle with finding support or care options within their community. And we get a lot of questions on the helpline about how do I find a facility that specializes in FTD, or how do I find a place that knows how to care for somebody with FTD? And so, Stephanie, what guidance do you give people in trying to navigate their care options?
Yeah, so finding care options is always challenging, right? So, it's challenging both in the logistical sense, emotionally, and especially when you haven't thought about it before or didn't think that it was time for any of that yet. So, calling into the helpline can be very helpful at any stage to really talk through the process. Whether it's just how do I start, what kind of care is out there, finding resources in your area in that specific situation. Different types of care can be, in the home and community-based options, or it can be residential care. And because FTD is not well known or common like other dementias are, it often involves advocacy and adapting the services for that person's need. So we really help to, talk to you about different ways to build relationship with those services, to help search for different resources that can really, take the person-centered approach as well to the care. We also have some resources from AFTD that may be helpful when you're approaching providers to help educate them and identifying different strategies that may help your loved one specifically. We've also received phone calls from healthcare professionals on the helpline, and they want to learn more about FTD as well so that, they can have better care for their residents and members that they're taking care of. So we really encourage families to have their providers reach out to us so that we can help support them just as much as that we're supporting the families. And this conversation can really happen at any point during, the many transitions that can happen in FTD, and they're emotionally challenging for a lot of people. So we can take some of that off and help in both for the family and the person with FTD, as well as the healthcare professional as well.
Thank you, Stephanie. I think that's a pretty good answer. And unfortunately, we would love to see facilities that specialize in FTD care and offer specialized FTD services. But in the lack of that, it really comes down to education and finding people who are willing to investigate, who are curious, and are willing to kind of take a look at the person and really offer person-centered care and approaches. Another question we get a lot is, do we take calls and emails from Canada and other countries?
Yes. That is a yes question. Although we are based in the US, we are an American-based nonprofit. We do increasingly have international presence and actually do receive calls and emails from Canada and other international countries. So we provide information about FTD when we get those questions or emails, and we also share resources in those areas when we are aware of them. And one good thing too on the helpline, we also do have the ability to use our translation services to respond to questions in Spanish or other languages. In addition to that, our website do get translated into different languages, so that is a plus. So language is not a problem at all. So if you fear that, oh, maybe they don't speak Spanish or they don't, like, how do I get connected? Don't worry, we'll be able to help connect you to a translated services and provide you with the help that you need on the helpline.
That's great, Josephare. The helpline really has expanded by offering translation services now. And we also have resources available in Spanish for those who are Spanish speaking. So we are really looking to expand these services and hopefully be able to provide support to as many people as possible. Another question we get a lot, Josephare, and I think this is probably one of our most common questions, is I don't have a local support group in my area. How can I get connected with the national support groups or persons with FTD Zoom group?
No worries, no support group options. You don't if you don't know what your support groups are, we got you. We understand. So one of the biggest part of our missions is to get people connected with the support that they need. And we're always very happy to talk through the options on the helpline. Our support groups are led by experienced volunteers and like a peer-led model. And we have heard from others who have attended the group that once they attend a support group, it feels like they found some new friends that they knew that they never had before, which allows them to connect with others who understands FTD and also their experiences, which allow them to talk through their emotional impact or diagnosis and learn different strategies to help manage some of the most difficult FTD behaviors or symptoms. Local support groups can also be a resource. For finding local resources other family members have used and found to be helpful. You can find listing of those local support groups in our website. Those can be found under our resources page. And on those listings, you'll be able to find either local options or regional options for both care partners and also those who are diagnosed with FTD. Unfortunately, though, we do understand that for some people, there are still who do not have access to a local group. And those areas we offer a national groups. So we offer national groups for person diagnosed with FTD and for primary care partners who cannot have access to a local group. In certain caregiving situations, such as FTD ALS, we do have that options as well. We also offer school-age children. Those are for the care partners who are caring for loved one with FTD, and also have children in the home. In addition to that, we do have a support group specifically for men who are caring for their partners. And those who are interested, as always, are welcome to reach out to us on the helpline directly to just learn more about the groups and learn about how they are meetings, just the dynamics of the group, and how to get connected to the leader. There are also national groups about the adult children's. We did not forget about the children's. So we do have a young adult group for young adults who are caring for their parents with FTD. And we also have online options, such as our AFTD closed Facebook group, in addition to a young adult Facebook group for those young generations who are caring for their mom or dad or just maybe just a loved one. We have those support options available for you. If you have any problems finding them, reach out to the helpline. We are happy to just walk you through the options that we have.
Thank you, Josephare. And I think one thing to note is that many of our groups that do meet locally meet via Zoom or our regional groups. So they may cover half the state of Texas, or they might cover a larger area. So the helpline is a great resource for you to be able to reach out and learn more about what support options are available to you within your community, as well as the AFTD website.
Mm-hmm.
We have a question from our audience, and it has to do with what qualifies or what are the symptoms of behavioral variant FTD, and is aggression always noted? I am happy to answer this question if you guys want me to take a stab first, and then you guys can kind of chime in. But behavioral variant FTD is actually diagnosed based on, you have to have 3 of 6 common symptoms. And so those 6 symptoms are apathy, loss of empathy, executive dysfunction, compulsive behaviors, hyperorality, and I'm missing one, guys. What is the last one? Look it up real quick. Disinhibition. Oh, disinhibition. That's the last one. Disinhibition. Not everybody with behavioral variant FTD has aggressive behaviors. Once again, we're going to go back to the fact that if you've met one person with FTD, you've met one person with FTD. Some people with behavioral variant FTD do have aggressive behaviors, and they do have a lot of compulsive behaviors, and they don't always have great, because of disinhibition, they don't have the ability to inhibit some probably negative behaviors that in the past they were able to inhibit and control. And so because of that, sometimes aggression can happen in FTD, but it does not mean that it happens to everyone. And we hear from many families and talk to many individuals where aggression is not always a symptom, and it's not even something that their family is dealing with. Whereas they may be dealing with a lot of apathy, or they may be dealing with a lot of compulsive behaviors, and that might be the primary symptom that they're kind of working through. So not everyone with behavioral variant FTD has aggressive behaviors, and it's important that you kind of understand that it could be a wide range of different symptoms that could be occurring. Once again, FTD looks different in different people who very often have a very similar diagnosis. Do you guys want to add anything to that, or?
Yeah, I mean, I think just as we said before, yeah, that how much it can vary so much from person to person. I mean, they're looking at this list of symptoms, but yeah, some people may not, show certain symptoms, or it may present in a more subtle way. And it can change over time. Mm-hmm.
So we have another question here about how do I find out about research opportunities? Does somebody want to talk about how people can engage with research?
Yes, I mean, registering with AFTD can help keep you informed with all of the new resources that are going on, and also the registry. So, AFTD has partnered with the FTD registry, and you can sign up where you can get notifications of different research opportunities and trials that are going on that you may qualify for, or your loved one may qualify for. And even just to help navigate talking about brain donation options, our website has a lot of information on there, and the FTD registry is definitely another big resource that we can offer for somebody.
Wonderful. I'm looking through some of these questions from the audience. Can we talk a little bit more about anosognosia and driving and some of the difficulties in that? I know we recently did a help and hope on that, and I think we did a piece in a partners at one point too. But driving in FTD is a bigger, it's an ongoing issue, and this is really why we encourage you to call the helpline, because the advice I might give Stephanie might not be the same advice we might give Anne when it comes to driving. But Anne, can you talk a little bit more about anosognosia, and then I can talk about some different ways to kind of combat that, and you guys can, if you have any other ideas about how you've talked through how families can navigate it.
Mm-hmm. Yeah, so that term anosognosia, as we were talking about, you have to learn new language, but the other way to talk about that is like just the lack of insight or awareness, where to the person with FTD, They think everything's fine, they're doing really well, can't recognize that there may be changes that are becoming concerning to those around them. So in those situations, it's those around them, their support network, who have to start to recognize, when some other supports need to come in to create safety. So driving certainly is a complicated one. I think, and what is really complicated in terms of FTD is that people say, well, I drive with my loved one, they know all the skills, they can stop, but driving is really complex, right? It involves a lot of different functions. And so sometimes the changes in FTD that can make driving unsafe, maybe more subtle, like changes in judgment or reasoning, or sometimes in the changes of in language and communication, being able to recognize signs and cues. So it can be less apparent when it's no longer safe. And so there are, this varies a little bit depending on what state you're in. There's some states that when someone's diagnosed with any kind of dementia, it does automatically report to your Department of Motor Vehicles, or your medical provider may have to report that, which sometimes can just trigger that you have to come in for another driving test, but that's not in every state. And sometimes concerned loved ones can also make a report like that. There are in some areas where there are driving evaluation programs, sometimes done by occupational therapists. And this can be just a more in-depth evaluation to better understand, is this still safe? Do we need to look at making a transition from driving? But even with those formal processes, a person might still choose to pick up the keys and go. Driving is such a huge independence for people. It's really hard to stop, to stop driving. It's how you stay connected in the community. So that means that sometimes you still have to think of other ways to make sure the person can still get the places they want to, and you might have to find creative ways to limit their access to the car and the keys, even if their license has been taken away, because of these issues with anosognosia. So this sometimes, is removing the vehicle from the property in some cases, replacing keys. So it can get really, individualized, because there's still a person with FTD is still really, they're still really involved. They still know, that this has been such a big change, and we want to be really supportive of that and making sure we're finding ways to keep them independent, along with providing more safety and support over time as they need it. So that's just kind of overview, but then we do talk more individually about what can we do to keep the person safe when they no longer are able to drive.
Yeah, I think another question we get a lot, and maybe Stephanie, this is a question that's come up a couple times here that you can kind of answer, but when your loved one is 55 and you're trying to find services or resources in your community, where do you tell people is the best way to start to look to see what's available in your local community? And I'm talking about all resources, not even just facility care, but how do you find what's even available to you?
Yeah, it can be tricky, right? So, not many people know about FTD in general, and then you're looking for a unicorn with services that may know a little bit about FTD. So a lot of times, even just reaching out to local support group leaders or our ambassadors, which are lead volunteers that are out and about in the communities, can be a great asset to even just connect you to somebody of, this person had somebody in this facility or use this home care or adult day, or, we can kind of get creative with some of those things. And even just in general with, hearing from others who call in on the helpline that, we have people who tell us all the time, just so I use this service and they were fantastic. And, now they know a little bit about FTD, so they might be a good resource for somebody else. And, just kind of word of mouth are able to help out with locating some of those services or connecting you to somebody who may have a good idea about some other services.
Yeah, thank you. I think another question that came up that is probably one that we can answer today is, what is disinhibition? Do you guys, any of you want to tackle that, or I can tackle it if you want? I'll tackle it and you guys can edit. So disinhibition is our brains, they have kind of a filter on them normally, right? If you think something and you know it's inappropriate, we don't always say it. If we walk into a room and we see something that's off, or we have a thought, it doesn't usually come out of our mouths because we have something in our brain that says, you know, that's not socially appropriate. That's not a kind thing to say. We don't say that. When you have disinhibitive behaviors, that filter goes. So the thing you think comes right out your mouth, or the thing you think you just do, you don't necessarily have that same stopgap that many of us have. And this can be very alarming, because when you have disinhibitive behaviors, you act very quickly, and you can do things like grab something really quickly, or grab a hand, or grab a brush, or you're going to just respond without thinking through what your response means. Whereas typically a lot of us have the ability to be able to filter that. And sometimes in the beginning it might be small. They may just start with slipping of things, saying things they wouldn't normally say. And then as the disease progresses, you may see more of that behavior continue to happen. But once again, not everybody has disinhibitive behavior. Not everybody displays that symptom, but it is a common one we see in behavioral variant FTD. And it's very often why we hear people just say, they just say things, or they just act. If they see somebody beautiful, they just walk up and kiss them. They don't think twice about it. And the more you can educate your community, and we're going to talk about some resources AFTD has to help you educate providers and your community, the more that you're going to be able to help them be more understanding, right? When somebody understands that they have a diagnosis of FTD and this is one of their symptoms, they're not going to be so alarmed if they say something inappropriate. They're going to recognize that it's part of the disease. And we always want to recognize that the behavior or what's being expressed is not the person, it's the disease causing that. And I think that's a really important distinction that we always want to make and understand, is that it's not the person, it's the disease. I say this all the time because I just think it's a great analogy, but a lot of families, they name the disease to help them separate the disease from the person, so that they can continue to provide care to the person and understand that it's not the person who's trying to be impulsive, or they're not doing this on purpose. It's the disease that's kind of changing their ability to be able to manage some of these situations. And the more you can separate that from the person, very often people are more successful. Is there anything else you guys want to add about disinhibition?
And as we were talking about driving, I think it's one thing as driving, when disinhibition hate is just like, if your loved one is driving and they're supposed to wait for the red light, they just kind of drive through because their mind is not telling them, oh, I need to wait for that red light. So which is where safety again become a problem.
It's a good point, Josephare. It's a good thing to look at. We have like 5 more minutes for one more question. So I'm looking through here to see what might be a good one to ask you guys. We get asked the question a lot, and this is a good one in here, is when is the right time to tell family and friends about a diagnosis? What do you guys normally recommend to people when they get that question?
Yeah, so I think this is again something that is very personalized, as we always say, but again, not knowing that when we have these talks on the helpline, we can really kind of talk through that and have a tailored conversation. But knowing that people often have gone through so much before they've actually gotten this FTD diagnosis, where they may have broken relationships, distanced themselves from people, may have said really hurtful things to people. So for a lot of people, they share, when we get this actual diagnosis, it can explain a lot of things that have happened, but still some of those feelings remain. So Some people find that, being able to share the diagnosis can help, people start to process it. And, you can decide for yourself, who's going to be in this kind of inner circle of your support network, sharing with them about the diagnosis. Who do you need by you as you're just initially trying to wrap your head around this and learn about it? And then start to think about, how do we share this with others? And you can, when you're first sharing this, you may still have a ton of questions about FTD. So, you can share the AFTD with them so that you're not always the one they're coming to ask, and you may not be able to really handle that. You already have so many questions of your own. So using us as a resource, but knowing that some people just really might not get it, or might say things that are not helpful, like, oh, well, they seem fine to me, or I've never noticed that. Yeah, are you sure? And that's really hard when you've gone through so much just to get this answer. So, recognizing that, we can only do so much, and helping others, come around to this. They may over time. You can direct them to get more information. But sharing it can allow you, to build this support network, name it, help preserve the person's reputation too, to explain, yeah, a lot of things have been unusual, the last couple years, but we know that this is why now. And you can also use that to spread awareness about FTD, that you can say, this is what my loved one has, in sharing their story, or sharing that you have this diagnosis is so, so important overall, so that when you're sharing the diagnosis with people, they don't say, I have no idea what that is. They might now, as awareness spreads, start to say, oh, I've read about that, I've heard about that. And that is really, I know that when people have those experiences, it's really, really amazing. I think even for our staff, when we're trying to explain FTD, when we meet somebody who says, oh yeah, I have heard about that, we know what that's like. So yeah, I think it's really, it's an important question that people have when you first get this diagnosis, and it is, it's really helpful to sit down and really think about it, how you're going to start to tell everybody about this diagnosis.
So I really want to thank everyone for all of your really great questions. And some of these questions are really individualized. So we're going to try to actually get back to you and email you back with some answers that are a little bit more supportive and individualized to your personal needs. That's one of the beauties of the helpline, is that you can talk to somebody who can help you work through what's happening with you. And I think for a lot of families, that's the biggest benefit. So if we did not answer your question today, please know that we will answer your questions, and we will try to get back to you with some information and resources. That being said, the helpline team wanted to go through some of the most common resources that we have here at AFTD to help you better navigate the diagnosis and what it means to live with this disease. So Stephanie, do you want to go first and talk a little bit about our grants?
Sure. So we have a Comstock grant program here at AFTD. There are 3 different types of grants. So there are grants for those with FTD called Quality of Life. There are grants for care partners taking care of their loved one called respite grants. And then we have travel grants so that you can join us for the education conference that we have every year, or other conferences that may have some FTD material. Every single grant is $500. So you are able to apply for, one of each if you need to every fiscal year. So we do run on fiscal year. So that's July 1st to June 30th. And, for the respite grant, it's really for that care partner to, what I say, be selfish, take care of yourself, fill your own cup. So whether that means you're paying a professional, a family member, a friend, to take care of your loved one, whether that's just self-care activities, go get a massage, go take care of yourself in some way so that you become a better care partner to take care of your loved one. For the Quality of Life grant, that is really for the person with FTD and their needs. So whether that's a new pair of sneakers because they're walking all the time, whether that's a hobby that they have that, may cost a little bit more money than you have in the budget, that's where this money really can come into play and to support that person with FTD and their needs. And like I said earlier, the travel grant is to, help educate, spread awareness, whether that's at our education conference or another conference that's out there.
Wonderful. Next slide. All right, let's talk a little bit about the FTD awareness cards.
Yes. One of the other resources that we offer, speaking of awareness and education, is the FTD awareness cards, which AFTD has for FTD and also PPA awareness. We have that in a few different versions, and we also have that in both English and Spanish. And those resources are typically located in our page, and under our resources page, there are versions for care partners, person with a diagnosis, and also we have the FTD PPA that can be helpful to just help educate and help raise awareness to different care partners, family members, or just basically anyone that you come encounter with, just to help them better understand FTD and to help them understand what you and your loved one are going through. For example, one of the versions that we have says, please pardon my language and behavior. I have a brain disease called frontotemporal degenerations, and it says also thank you for your patience, and it also asks you to refer back to our website, which also allow them to not only learn more about FTD but also learn more about AFTD and the resources that we offer. Those are just one helpful things that we offer in addition to the wonderful Comstat grant program.
Next slide. All right, Anne.
Yeah, and just a reminder to everybody, you will get an email with these links, so you can find them. But this is our recommended reading and viewing site. I love to recommend this to people, where we have lists of webinars, books, blogs, podcasts, that are really people sharing their firsthand experiences with FTD. So I think what's really great about a lot of these resources is that you get to hear often the story from the beginning through the end, which I think is just really helpful, and really hear about the individual. I think it's a great way to learn by hearing stories, and you learn something from every story and how they navigated it. So you'll find it from all different perspectives, different family members, from people with FTD. So I just encourage you to look around. You may find something that really resonates with you, so that you can learn more. So yeah, and it also, but it's not only books. If you're not a reader, there are webinars and videos. It does link to our AFTD YouTube page, which has so many videos, from our conferences and webinars that are just really wonderful resources that I love to share.
Next slide, yeah.
Next, resources that we have is the provider letter. Our provider letter can be found again in our resources page and our website. This letter can be used to share with professionals, again, with anyone that you encounter. And one of the great things about this letter is just a one-page letter, very straightforward and simple. So whether or not you are going to a new doctor, whether or not you are educating a loved one, or just simply wanting people to understand, this one page just basically explain what FTD is and explain to, let's say, a new provider the reason why you are visiting them today. It just basically is doing the works for you if you aren't able to fully explain exactly what FTD is and the reason why you are sharing your story or going to a doctor who may or may not have the expertise of FTD.
So this past year, we released the new resource for the behavior tracker. And this is really a document that you can, use to help track symptoms or identify patterns or different approaches that may or may not work for your loved one. This can be useful as a communication tool that you can take with you to doctor's appointments to talk about symptom changes or potential treatment options. So you don't have to remember every little detail of what happened, but it's kind of a journal that you can keep track and then facilitate a conversation with your provider.
I think these are the FTD behavior tracker too is a great tool for your healthcare provider, because that helps them also be able to work with you to figure out the behaviors. When you come to your appointments and you can say to them, I'm noticing every day at 4:30, we're seeing this behavior, or there's incontinence happening at nighttime, but I'm noticing it happens every night when we eat dinner at 6, or, you know, the more information you can give and details you can give, very often your healthcare provider can work with you to help identify triggers. Sometimes there's medications not being given at the right time, or they can be given at a different time to avoid a behavior or a situation. Sometimes they have other recommendations or ideas to help you kind of manage the situation. So as a nurse, I recommend the FTD behavior tracker to everyone, because I think it really helps you better communicate with your providers as to what you're dealing with. Sorry, Stephanie, I had to chime in on that one.
That's okay.
Next slide.
All right, so this is one of our AFTD publications. This is our Walking with Grief, Loss, and the FTD Journey. So this booklet, you know, it's not only for those who have their loved one has passed. This really talks about this experience of grief and loss that we have throughout the journey. So even it starts in the first section about early diagnosis and works through, and it's sharing people's firsthand experiences, which obviously is still like another really great way to learn and hear how other people have navigated this and help you find words to explain what you've experienced. And this also is set up like a workbook. There's places for you to take notes. It's spiral bound if you ask us for a hard copy. It is electronic on our website too. So it's a really great resource to recognize that, you know, people are trying to provide care and support, but in the midst of dealing with your own emotional, grief and loss experience with this throughout. So I think it's a really wonderful tool. I recommend you take a look at it, and then let us know if you want us to send you a copy.
So our diagnostic checklists, we have two, as we stated a little bit earlier, one for behavioral variant FTD and the other for PPA. Both of these are translated into Spanish as well. And as you can see on the slide, there's a checklist. So you can go through and check off which symptoms you're seeing in your loved one or you feel you're experiencing yourself. And then on the back, which is really useful for healthcare professionals, are the diagnostic criteria, so that it starts the conversation for you, helps educate the healthcare professional, and they can definitely be a really good resource to have that conversation and to start the conversation for you with your healthcare professional.
Okay, this is our Partners in FTD Care resource. So this is actually our quarterly resource for healthcare professionals, but it still can be really helpful for people with FTD and care partners, because each issue takes a deep dive into a challenge in FTD or a symptom or a diagnosis, and we use information from researchers and experts to give you, the best resources to better understand the issue, and also suggested approaches. What can we do in these situations? So you see on the screen, there's one that was talking about the transition to residential care. So again, it's originally geared for health professionals, but still really useful for families too. So we recommend these a lot. Definitely a great resource to check out.
All right, so thank you, Stephanie, Ann, and Josephare, for all of your information and help today. It is wonderful having you guys on board and part of the team here. You have done a wonderful job. Last year alone, this team answered over 3,000 calls and emails that came in from the community every day, and they're here to help. They want to be able to help you navigate the disease and make sure you're getting the resources and information that you need. As I stated earlier, that this webinar was recorded, along with all of the resources that we talked about today will be coming in an email for you later this week, and you'll be able to go back and reference it and be able to look and see a little bit more about what we talked to and what we dug into. The next AFTD webinar will take place on October 19th. Guest presenter Mary O'Hara of the University of Colorado will talk about grief, loss, and hope amid the FTD journey. The content for this webinar will be geared towards healthcare professionals, and continuing education credits will be offered to those who watch the presentation live. Please feel free to share this event with your healthcare providers that you work with every day. Please let us know if you have any comments or questions about today's presentation. Thank you for watching and take care.